Welcome to another edition of Your Health Matters with Dr. Benjamin Bryant, Chief of Staff and General Surgeon here at Conneaut Medical Center. Dr. Ben, this is June 8th, and I had to almost wear snow pants to this show today.
Yeah, global warming.
Oh my! I mean, shorts 2 days ago, and then today long pants and sweater. It's
Makes for good sleeping at night.
it
That's what I
did.
said.
Yes, it does. It really does. I see we had a friend with us today.
Oh, well, we're really glad today to welcome Denise Amato, who is sort of in charge of all of the community outreach and programs that UH puts on, and has her finger on all the developments that are taking place inside the hospital. So she's going to talk to us about quite a number of different things, initiatives that the hospital is involved in, a lot of community-oriented programming and so on.
Yep, got a lot to cover.
We got a lot to cover, so Denise, why don't you just go ahead?
Okay.
What is up with that tent?
I know. That's a gorgeous tent out there. Recently, Conneaut Medical Center was awarded a 5-star designation from the Centers for Medicaid and Medicare Services, and that is as a result of our excellent patient satisfaction scores.
Folks, that's a big deal.
Yeah,
This is
that is a big deal.
This is a very big deal.
Only 4% of the hospitals in the country received that designation, which was actually ended up being 155 hospitals. Only 7 hospitals in the state of Ohio received it, and UH Conneaut Medical Center and UH Geneva Medical Center were the only 2 in northeastern Ohio that received it.
And I think they got it last year, too.
Yeah, the second year in a row for
Yeah,
Conneaut.
yeah.
Yes, it is. So what we did is we put on a little celebration for all of the employees yesterday. Everyone was invited. We all had these great t-shirts that had our 5 stars on the back for patient experience, just to kind of thank every employee and let everybody know it can't be done without everyone's teamwork and effort.
You know, it's not uncommon for me to have a patient come back to the office after a procedure, and they say, I've never had an experience like that. They say not only were the nurses incredibly attentive and supportive, but even any of the staff, even the custodial staff, you know, you can tell that they really are committed to this hospital.
Definitely.
So it's top to bottom.
Right. And we were very fortunate. The new Chief Experience Officer for the system for UH actually came out yesterday and thanked all of the employees for their
great.
efforts, because we're a flagship where we have best practices for the entire system that they're going to adopt across other hospitals that are struggling with patient satisfaction scores. So,
Think about that, folks. Within this huge UH system, what is the leader? This hospital.
Yeah. Yeah, so we have a lot to be proud of. We've also implemented some new good night strategies, actually, to enhance the patient's experience. And I'm not gonna spill what all of those are at this time, but just know that if anyone's ever in the hospital for an overnight stay, they are going to see some enhancements as well, because once you've set the bar so high, you've got to continue to strive keep to raise it. So
That's right.
we are instituting some new things as well that I think the patients will enjoy.
That's fantastic.
Yeah. So that's the big deal with the tent. So that was a great.
I wonder what that tent was doing out there.
Yeah. With that, we're having some big party, and we were having a big party. It was a lot of fun.
That's great.
Well, that's one of the reasons why people who work at this hospital have that level of commitment. It's because they know that the entire UH organization really appreciates what they do, and they show it.
Right. That's why you have people that stay at this hospital for 35 years, 30 years, 25 years.
That's
We had
right.
a couple retire, have 40 years. That's why they stay in the community.
That's right.
Yeah.
That's right.
So I'm glad you asked me about that, because that was on my list of things I wanted to talk about, because we were all really excited. But a couple other things I want to talk about are some things that are going on in the community. Every month we put out a Health Matters calendar of things that are happening. Actually tonight, and it's kind of short notice, nobody's going to know, but I do want to mention that we do a Health Matters series. Dr. Bryant will be the speaker this evening on men's health.
I did mention that at the
yeah.
last, but that hasn't aired yet.
Yeah, it
so-
hasn't aired yet.
So we'll see.
Yeah, but we do offer a Health Matters series the second Wednesday of every month. Next month, we will be talking about common muscle injuries and sports injuries, and that will be hosted at Geneva Medical Center. So watch for information to come out on that as well.
And that is free, folks.
Free. And there are light refreshments served, there's valuable information, and really it's, it's really invaluable that we share. We hope more residents start taking advantage of those
And I
informative
believe,
series.
excuse me, Denise, I'm sorry.
No, you're fine.
Doc, you're going to be talking about prostate.
That's an issue I really want to cover tonight.
Yeah.
Now, of
Yes.
course, there's going to be
Yeah.
other things, and if people have questions, we'll
Mhm.
and we, as we've mentioned before, this is a real informal thing. It's not like a doc is standing up there giving a lecture. It's not
Yeah.
like that. It's like everybody sits down together in a relaxed way, and people get a chance to ask whatever they want.
Mhm. Yeah.
That's cool.
So our health screenings that we do in Conneaut too, I know there's been a little bit of confusion. We used to do them the second Tuesday of the month here in the hospital in the lobby. We would do blood pressure, cholesterol, glucose checks. There were months we had nobody come. There were months we had 2 people come. So what we've done is now we're just doing them monthly at the Conneaut Human Resource Center. And the next one of those coming up is Tuesday, June the 21st from 8:30 to 11:30 a.m. There's no need to make a reservation or let anybody know you come. Just show up and we will do the blood pressure, cholesterol, and glucose at that time.
And this doesn't cost the patients?
No, this is free. All of our monthly events that we're holding, unless otherwise noted, if it's something that UH is sponsoring, is free. We also started a diabetes support group here in Conneaut, and actually we've had a very good turnout. The last couple of times we had about 20 folks come, and the next one of those will be Thursday, June 16th from 10:30 to 11:30 in the morning, also at the Human Resource Center.
You know, as that moves forward, that's an excellent program. As that moves forward, maybe you can let me know what some future dates are, because it might be very beneficial to have Dr. Regula come and talk to that group.
That might be, yes.
The reason being is that on the last segment, it hasn't aired yet, but folks will see it. Dr. Regula was talking about a surgical procedure that basically cures type 2 diabetes.
Wow.
And he presented a paper that it was just published out of London, a huge international group. I mean, very, very credible. And what they're finding is that it's similar to a bariatric procedure, but it's a little bit different. But one of the effects of it that is demonstrated, proven, reproducible, is that people with type 2 diabetes, regardless of what their weight is, get off all of their diabetic medications.
Wow, that's fantastic.
I mean, this is so revolutionary, this is mind-blowing. And I mean, that support group would be, I think, you'd be talking to people who it's really relevant to. So I'll mention this to Tom, and if you can get me some dates, and we'll see if he
I
wants to
will.
do that. But that could be a really good thing.
Well, in the future too, and this is kind of down the road, but I'll mention it now because I feel like I'm only on this show at the end of the year and the middle of the year, but on November 5th, we'll be hosting our lifelong health event at Andrus Banquet Center. And we get, gosh, the last one we just did there in May for our women's event, we had over 150 people come.
Fantastic.
I would love to see maybe him be the keynote speaker and speak to that topic.
Get me the information,
I will.
and
That's fantastic.
I'll talk to him about it. I'll let him know what's going on
Yeah.
about it. I'm sure he'd be more.
Yeah,
than
because
willing
that's
to do
free
that.
to the community. We do a gamut of free health screenings. We have physician speakers panels. I know you've participated in the past.
Yes, I
And it's just a fabulous event. So mark your calendars for November 5th.
And Dr. Regula, Doc and I taped this interview with him, a couple weeks ago, Doc? And it's going to be on in the next couple of weeks. Check it out. It's one of the best segments we've done, I believe, because he brings a patient in that was very, very sick with diabetes, and he had the surgery, and
He's off all his diabetic medication.
all of them. I mean, the
He's off
numbers
all
went
of them.
completely down and off the
His blood
charts.
sugar is now normal,
Yeah,
and not on any medications. And he'd been on 4 different diabetic medications for years.
Yeah,
Wow, that's fantastic.
it's excellent. It's an excellent segment.
It's so revolutionary.
Yeah. Good.
So,
Some of the other programs that we are running now in Conneaut this summer, new this year, is our summer walk program. Kicked off the very first one yesterday. It is at the Conneaut Township Park, and they meet down at the lower pavilion by the boardwalk. And it's from 8 to 8:45, and it's with part of our Age Well, Be Well program. So everybody that comes, and actually the very first time you come, you get some free gifts. I believe a T-shirt may be the very first gift that you're getting when you show up for this program. Yesterday we had, in spite of the windy weather and a little bit of chill in the air, we actually had 8 people come out and walk, and we bring a clinical expert. It's not always going to be a physician. Sometimes it's a nurse, might be PT, somebody from physical therapy, might be the dietitian, but they'll walk along with you as well and share some valuable information. And I heard tell that they got 5,500 steps in yesterday on their walk.
wow,
So yeah, so it was a really good walk. So
that's great.
anybody's interested, and this will go from June to September, will always be every single Thursday down at the park, rain or shine.
That's fantastic.
If you'd like additional information, and I probably should have warned everyone to get your paper and pen out before I started talking, because I'm going to throw a few numbers out today.
Well, we'll make sure that those numbers appear on the
Okay.
screen.
So if you're interested in the Get Walking program, the number is 998-0107.
That's every Thursday?
That is every Thursday. You might want to go do that.
I should.
8 to 8:45. Yeah, it's a lot of fun. It really
Right
is.
down there too. It's
Yeah.
like I'm right next door.
Yeah, 8 to 8:45 down there at the Township Park.
Okay.
Very good.
Another program that will be starting in, I believe it's June. It's called the Get Connected program, and it is also part of our Age Well, Be Well program. Actually, I apologize, it starts in July. The very first one will be July 11th here in the W.H. Brown Room. And it is a program where we've partnered with some of the students at Conneaut High School. And they're going to come in and they're going to teach anybody who wants to learn how to get online. We're going to bring some iPads and some laptops. If they want to learn how to log on, set up an email address, create a My UH Cares account so they can connect up with their physicians and keep track of their medical records online. It's also free of charge, and the students are volunteering their time to do this. And so the first one will be July 11th at 10 o'clock here, then there will be one every month, and I'm not sure which day of the month that falls on, August 15th, September 19th, it'll go all the way through the end of the year. And that will be available free to anybody who wants to come and participate in that. And also, if you're interested in more information on that or signing up, the number for that also is 998-0107.
UH has pretty much consistently had the philosophy that the more people are involved in their own health care, the better off they are. The more they know, the better off they are. It's not even really an issue of transparency. I've talked to several, this is crazy, but I've talked to several patients, many patients through the years, who have wanted to see their medical record, and they were told, no, we can't show it to you, we're not going to show it to you, this and that. Wow, that's crazy, pardon me, but that's really crazy. We want people to really know what's going on with them. We want them to know what the doctor said, to know what the doctor wrote down, to know what their lab results are, to know what their studies are, to really know what's going on with them, and to know why they're doing the things that they're doing. And this makes it sounds like it might be difficult. It's not. This makes it very, very easy to go in. People jump up on the internet all the time. They go to this site, they go to that site, trying to figure out about different medical things. Here you can go right into your own record and see exactly what's going on with you.
Well, and I think one of the really important things to understand, because I do use the website as well, and it's incredibly valuable information, is it is completely secure. And I do think in this day and age when people are concerned about their privacy and people getting your social security number, stealing your identity, knowing your medical history, but to understand that you can access this in the privacy of your own home, and it is a completely secure website,
UH goes to
Yeah.
incredible lengths to make sure that it's secure.
Yeah,
I mean,
yeah.
that information is not going to get out.
Yeah. And it really empowers you. You know, you may read something in there that you're like, wow, my doctor dictated this or said this, but I don't remember them telling me this. Gives you an opportunity to follow up with your physician. I didn't hear this when we talked. Could you explain to me again what this meant, or did I miss something? You know, I think it's really important.
Mhm.
Because a lot of times when you're sitting in the office, you don't hear everything. I know I don't hear everything. I hear what I want to hear. So that's what the Get Connected program is all about. So it's really important. And again, we're offering it free of charge. Smokeless is another program that we continue to do. It's a smoking cessation program. What we have changed up the program a little bit. There has always been a fee, $45 to participate in the program. And the really nice thing about this is it's 5 sessions that you attend. It's not a 6-week program. It is evidence-based, it's proven to work, and we have our next session coming up in Geneva next week, and we already have 8 people signed up.
Folks, that fee, that's 4.5 packs
Right.
of cigarettes.
Well, the important thing about that fee now
That's all it is.
once you complete those 5 days, we give you that money back.
Whoa.
Because UH is providing a kit that costs way more than the $45, but to us, it's part of our community. We need to make a difference in smoking. We need that, the lung cancers are on the rise. So to us, it's important just that every single person that quits is meaningful to us. So once you complete that course, we're giving your $45 back and say, here's your kit. We've taught you how to do it, and then there's support afterwards. There's support groups that have formed. Geneva has a very active support group of folks who meet on a regular basis now because they all quit smoking together. So they come and they talk about some of the challenges. Well, this happened in my life. I wanted to pick up a cigarette, but I did this instead. So
Do you charge the 45 to give them the incentive to make sure they come to?
yes, because you get a kit on the first day.
Right.
So what we don't want you to do is say, here's my $45, or if we didn't charge it,
Right.
and we said, here's your kit here on the first day, and then you didn't come back from the next 4, chances are you're not going to be successful
Right.
in quitting.
Right.
Because it's all about all of the steps that happens in those 5 days.
Makes sense.
So that next class is coming up, let's see, well, it starts on June 13th, but I don't think this show will air before that. I'm lost on my days.
No.
So probably not.
Yep.
However, there is a number that you can call if you're interested in finding out when the next class is. And what we have decided as a group is the summertime's a little bit more challenging to get people together. There's not as much of an interest. But if anybody were to call us and say, listen, I've made this decision today, I want to quit, we will set up a one-on-one training. That's how important it is to us. But for any information on the smokeless program, you can call 992-3639 to find out when the next session is, or if you're ready to quit today and you want to find out what do I need to do to quit today. We have about, I think we have 2 or 3 therapists, respiratory therapists in Geneva that are all trained in the smokeless program, and we have 3 girls in our community outreach program that are all trained in the smokeless program too. So somehow if somebody makes the decision they want to quit, we can certainly help get you there.
And this program has been demonstrated to work.
Mm-hmm. Yep.
So everybody, I think the number of people who smoke cigarettes who just don't care and don't want to quit, I think that's a pretty small number. I think most people who smoke cigarettes have tried to quit,
Mm-hmm.
would really like to quit. They understand, they're not stupid, they understand what they're doing to themselves and what they're setting themselves up for. If they have access to something that has been shown to actually work,
Mm-hmm.
okay?
Yeah.
That's really significant. So folks, anybody who's hearing this who smokes cigarettes and would like to stop, the door is open.
Yeah.
And this just demonstrates UH's commitment to the community, that they will put a program on like this where we incur a cost,
Mm-hmm.
and that cost is not passed on to you,
Right.
okay? So the door's open for you to finally, and the sense of accomplishment that comes when you're successful.
Mm-hmm.
You have quit smoking. That's a life-changing thing. It gives you confidence in your life that you just can't get any other way.
And I wish we have there's a survey after somebody completes the program. They can answer, how effective was this? This is going to help you, and any comments. And I wish I would remember, next time I'm on the show, I'm going to bring some of the comments that folks have written to us about how this has actually changed their lives.
Fantastic.
Yeah. And some of the other events that we've got coming up, July 16th is our annual Family Health and Safety Day, and we're going to be holding this year at the Ashtabula Health Center. And it is from 9 to 1. It is open to everybody in the community to come out and participate. We will be having free screenings, which will include, and this is a little more extensive list than we normally do on a regular basis. We are going to have free skin cancer screenings, free lower extremity vascular screenings, hearing for, we're going to have pediatric hearing, and I'll talk a little bit why we're going to do that, pediatric and adult hearing tests, carotid artery screenings, and then your typical blood pressures, cholesterol, glucose, stroke and diabetic assessments, grip and balance, mini PFTs. We're going to be doing the free bike helmet fittings with our Safe Communities group, and then the Rainbow Safety Squad will be there as well.
Now this is the center that's right there on Lake Road.
Yeah, this is at 2131 Lake Avenue. And there'll be more information coming in the newspapers.
It's got a huge UH sign on
Yeah.
it, so you can see.
Yeah. It's a
very
great
impressive.
location, actually. Everything will be inside. And, so come rain or shine, everything will be indoors. We don't have to worry about battling the weather this year. But that is going to be the one big event that we're going to do this summer.
Denise, for years, I've covered when it was Brown Memorial and then now UH for years, they had health fairs. Is this similar to that?
Yes, yeah, it is. And last year we held 3 of them, and what we found was that we had a lot of the same people coming to the same one. And because we share a lot of resources between the 2 hospitals, it was very difficult to pull it off the way that we wanted to and have all of the screenings and everybody participate. So we decided to centrally locate it this summer in Ashtabula. Doesn't mean that next year maybe we'll say, okay, next year we'll do it in Conneaut, and the year after we'll do it in Geneva, and then we'll move it back to Ashtabula. We may do it on a rotating basis. But because we are not holding that specifically in Conneaut this year, Good Shepherd Church is hosting a block party. I don't know if everybody's heard about that, but it's on July 9th at the Bluff at Conneaut Township Park. And it's going to be a big family health event too. So we are going to participate in that with them and bring our bike helmets and do education and some screenings at that event too on July 9th.
These are fantastic community assets here, because I know friends that have gone to these I call them health fairs,
Yeah.
that have had their blood pressure checked or their cholesterol or glucose, and they found that they needed some treatment. I mean, and it was free. Everything was free.
Right.
So take advantage of this. It's a fantastic thing.
You've heard us cover on this show so many times blood pressure, blood sugar. We've talked about it and talked about the implications of it and the things that happen. And here it is. Doesn't cost you anything.
Absolutely.
Right. So those are, just a couple of the events. Coming up over the next couple of weeks, we're going to participate. The Conneaut Art Center does their art camp. And I know it sounds kind of funny that the hospital's going to participate in the art camp, but we are really excited. We're going to be there June 14th and June 22nd. We're going to have a station outside. We're going to be there the whole day doing physical activities with the kids. We've come up with a lot of great an obstacle course and a scavenger hunt, and we've got prizes for the kids. But we're going to show them how to get out and add some fun and exercise, and show them that they're exercising but not even realizing they're exercising. So we got a lot of fun activities. So we're really excited that the Art Center asked us to participate in the art camp with them this year.
You know what impresses me, Doc, is the community involvement that I've never seen like this before with UH. I mean, you're all over the place, and you're covering a lot of different things. And I think it's wonderful. I think it's great. Yeah. I mean, whoever thought you'd be involved with that?
Art camp,
yeah,
I know.
I think it's great.
Yeah, we're excited.
Well, not to put too fine a point on it, but not every community has this.
That's correct.
Not every small community like ours has something like this.
That's true.
Yeah.
So we're very fortunate. So I think that's it. I'm going to cover for we got so many events coming on, but I think I'm going to move on to some fun hospital news. So I've already talked about our 5-star celebration. So, what are some of the specialties do you think maybe we should be bringing into the hospital? We can probably tell the folks about. Anything exciting?
Well, yeah, there's a couple of very big deals. We had talked about Dr. Amato joining us.
Mhm.
He's a pulmonologist. When Dr. Argoti Green, the thoracic surgeon from Giaga, was on the show, we kind of touched on that a little bit and how significant that is.
Mhm.
I'm not sure what his starting date is. I know there have been a couple of issues, little loose ends that had to be tied up, but getting basically a full-time pulmonologist here in
Mhm.
Conneaut is huge.
Right.
And I'm going to tell you, a number of things are going to come from that, but perhaps not the least of which is that there are going to be lung cancers that are found when they are curable.
Mhm.
That is one of the things that just unquestionably is going to happen in this town.
Yes.
People are going to be found to have lung cancer at a point when it's completely curable.
Mhm.
You know, lung cancer, once the cow gets out of the barn, you can't get the cow back in.
Yeah.
I mean, once that, I mean, it's a terrible, devastating disease. But if it's caught early enough, it's completely curable.
Mhm.
And that is going to start happening
Mhm.
more when Dr. Amato gets to town. There's just no question about it.
Yeah, we're extremely fortunate. He actually is coming in towards the end of the month for a visit. We are going to tour the facility with him again, look at his space that he, with the space that we need to provide for him, and get a list of the type of specialty equipment that he wants us to see that is going to help him with early detection and treatment. So the hospital is extremely committed to bringing this to the community.
Absolutely, and beyond that, he's going to be the director of the ICU, and
Mhm.
there's going to be some changes in the ICU. The ICU is going to become more capable. It's going to become more sophisticated, and what that means is that there are a certain number of patients who would have had to be transferred to another
Mhm.
institution
Mhm.
that will now be
Be
able to
treated
stay in Conneaut and get the same level of care that they would have gotten at the other institution.
Wow.
That's a very, very big deal. I mean, that strengthens this hospital incredibly
Mhm.
to have that. So I'd say that's a fairly exciting thing.
Right, that's very exciting.
I understand that UH is moving forward with getting an ENT physician out here.
Yes.
Who's going to cover Conneaut. Probably won't be in Conneaut full-time. We're going to have to share him with Geneva,
Yeah.
which is fine.
Well,
But-
his office will be in Ashtabula, which is nice because it'll be a halfway point.
Yep.
And we've got the specialty suite over there where we're able to house him. But he is slated to start August 1st, actually.
Wow.
I know, I just found out the other day.
That's
So
fantastic.
we're very excited about that. He's coming from Boston, and his wife is also a physician. She is, I believe, a psychiatrist looking for also a position within the UH system as
Great,
well.
great.
So we're very excited about that.
We will have him-
definitely need an ENT.
Oh, absolutely. We'll have him on the segment when he gets here,
Mhm.
and several times after that, so that you can attach
Yeah.
a face and a name.
Yeah.
And he'll explain to you, what kinds of things that he does, and
Mhm.
that also strengthens us considerably to have an
Yeah.
ENT close by.
Yeah. Let's see, who else do we have coming on board? Well, part of bringing Dr. Mata in, so many of you, Dr. Perry Allworth's been on here before.
Sure, he's been on a couple of times.
He is getting increasingly more busy here in Conneaut, needing more space, more exam rooms, a little more time in their procedure room. So some of you, when you're visiting the hospital, might see some construction going on soon on the second floor. And what we're doing is we are creating some new banks of office clinic space for Dr. Perry Allworth and Dr. Mata and Dr. Milliman, who is the podiatrist. Because
She's been on a couple of times.
yeah, so they are increasingly getting busy, and with adding the physicians that we're needing to add, we're needing to find more space. So phase one of the construction up on the second floor will be creating some space for them in what historically has kind of been the administrative area. We're moving quality, we're moving medical records, we're moving people around because we know that this is important to find space for these physicians that we need to bring in.
Absolutely.
The other construction project, which is kind of on the horizon, will be creating a dedicated space for our Harrington Heart and Vascular Institute. And that will be down on the first floor right now. And so any of our cardiac patients that currently see Dr. Osmond or Dr. Benatti up on the second floor, eventually down the road within the next year, we're hoping, because it's a capital investment that the system is also investing in this hospital, is we're looking to move those physicians to an area where you can go see the physician, you can do your stress testing, you can do your nuclear testing, you can do all of your testing in one area instead of having to go, up the elevator, down the elevator, over here, over there. We're making it a dedicated space.
That's going to be much more efficient, much more pleasant experience for the patients.
Right. And one of the things that I think is important, the things that we don't see, that the patients don't see about the investment in the hospital. We're working on a new HVAC system that was very, very old. We're working on a new electrical system that's very, very old. The system, the UH system, is dedicating the funds to do that. So what that says to me is we are incredibly valuable to the system, because they're not going to spend the millions of dollars that it's going to take to upgrade the hospital if they don't intend to make this a key piece of the community.
Absolutely. Everybody has their own perspective on it. Denise has hers from an administrative and community outreach perspective. I kind of know some of the stuff that goes on doctor to doctor regarding the relationship between UH Conneaut and the UH system. And all I can do is just support what Denise just said. There is no question that UH considers this hospital to be extremely important. There's just, there's a huge level of commitment from UH as a system to this hospital.
Yeah, I agree. So, one exciting development too that I don't think anybody's heard about, it probably really won't be in the news, but our Ohio Bone and Joint Institute, which is run by Dr. Seeds, has historically had very, very high patient outcomes for hip and knee replacement surgeries. And because of that, we were honored to be selected by GE as one of their centers of excellence. So what that means is employees from GE in Erie or anywhere in the country, honestly, could choose Conneaut Medical Center to come to have their joint replacement surgery. And it's a benefit to GE employees, but it is an honor for us to be selected.
Huge.
Yeah, they selected us and Case Medical Center as the only two UH facilities that meet their criteria based on patient outcomes. I think that is incredibly exciting.
That's
great.
That's beyond belief.
Yeah.
That is beyond belief.
So that says a lot about the staff. It says a lot about the protocols. It says a lot about Dr. Seeds and the relationships that he has with his patients and the staff here at the hospital.
That's right.
Yeah,
That's right.
so that's exciting, and that probably won't, make big front page news, but I'm incredibly excited about it.
Well, people, when the community hears stuff like this, whoa, this national company, GE, they could have chosen anybody.
Right.
And when a company like that, a company that's that big and sophisticated, they don't make their choices by accident.
No.
Okay, I mean, they're very careful about. And they chose our hospital.
It was a long process too. I don't know how much time we have left. I have a couple more things.
Go ahead.
Okay. Just a reminder about the urgent care that we have here in the hospital. It's located right next to the emergency room. It's open every day, 10 to 7. And the important thing about that is if you come to the emergency room, you do go to the emergency room window. They decide the acuity of what your care needs to be. If you're deemed to need emergency room care, then you're going to be directed to the emergency room. If it's something minor, more like a sprain or a sore throat or a cough or antibiotic or I don't know, even a couple little stitches, they're going to direct you over to the urgent care. The really great thing about that is there's a big difference between your co-pays for a lot of people between an emergency room visit and an urgent care visit. What this offers is the same level of care, the same training from the same type of people that are in the emergency room, but at a much lower cost, and you get through really, really quick. So
seems to have been well received so far.
Yeah, just as a reminder, only because we're heading into the summer months. A lot of times you've got visitors that are coming from out of town. You've got people in the cottages on the lake, and just, make sure that we're sharing that information with everyone as well. You don't need to go to the emergency room. Maybe, your level of care can just run into the urgent care and get it taken care of. The other exciting thing that did happen towards the end of last year, and now we do have some billboards up in Conneaut, I see, is we are a Rainbow Baby designated emergency room here in Conneaut and Geneva. But what that means is if we have trained to follow the same protocols as they do downtown at Rainbow Babies. So if a child were to come in here, whatever their acuity of care that they need, we will follow the exact same protocols that Rainbow follows to treat that patient. If that child needs to be transported out, then after we get them stable, whatever the case might be, that would be what would happen. But we are able to treat pediatric children the same way as they do at Rainbow.
I'm sure people realize that Rainbow is one of the top pediatric hospitals in the country.
Definitely.
I mean,
Yeah.
This isn't just somebody's opinion. There are a lot of different metrics that are measured to be able to say something like that, where big pediatric hospitals are compared to other big pediatric hospitals, and Rainbow is always way up at the top.
So that is just another. That was about an 18-month process to meet that
Huge
that
amount of work
criteria
behind
from
the
Rainbow.
scenes by a lot of people to make that happen.
So pretty soon you'll start seeing signage at the hospital that indicates that. I think the signage is about as difficult to get as the accreditation, to be perfectly honest.
It can be.
And actually the last thing I want to touch on is kind of a little plug. Dr. Bryant was gracious enough to participate in the Our Town series for Conneaut.
It was fun.
And that actually will be airing on WQLN out of Erie on June 30th at 8 p.m. And Dr. Bryant did a fabulous segment for us on the history of Brown and Medical Center, and talked a little bit about where we're at now, where we're going for the future. But I want to make sure everybody knows to tune in to that on June 30th on WQLN. I will probably be there. It'll be a live show. I'm kind of excited. I've never been, on a live fundraising show before, but I'm kind of excited. But the really neat thing is what they told us was they had more of a response from the city of Conneaut to participate in that show than the other 5 cities prior to us that they did in Pennsylvania. So it says a lot about the community and the pride that the community has. So we were really honored to be a part of it. I know I was.
Yeah, absolutely.
Yeah.
Yes, it was. It was fun to do it.
Yeah.
And
Definitely.
I think people would really enjoy it. It's a little bit of a different perspective. We would go over some of the history. And it's fun.
Yeah. So I think that's all I have.
Oh my gosh.
I know, sorry.
That's all?
That's all.
Well, folks, as you can see, it's a very dynamic situation. Initiatives all over the place, community outreach all over the place, strengthening the staff, deepening the staff, improving the hospital, constantly doing this. And you can see the effect that it has when we get the CMS 5-star award, when we have GE choose us as their joint replacement place. I mean, this all serves to illustrate to you the commitment that University Hospitals has to the city of Conneaut and what is available to you here. What is available to you here. So yes, folks, you can have pride and you can have confidence in your hospital.
I am so impressed, Denise, with all the stuff this hospital is doing, getting involved with the community, as I mentioned earlier. Fantastic. You do a great job.
Thank you. Have a great team.
We really appreciate Denise coming on and sharing with us today. It was great. We really appreciate it.
Thank you. Thank you for having me.
Our next show is going to feature Dr. Kumar.
Yes.
And we're going to talk about something, and I asked Doc, that I've had people, we went out to dinner here recently, and people were saying, can you ask Dr. Bryant about sunscreens and the heat stroke and all that stuff? So he set this up for us. So this is going to be great. So that'll be our next show coming up. So looking forward to that.
All right.
Your health matters. We'll see you next time. Bye-bye.